Thank you so much for joining us today. My name is Josh Babb. I'm the Senior Director of Federal Affairs here at McKesson. And if you don't know it, you stepped into a presentation touching on pharmacists, as well as an important initiative that we're taking on with the Future of Pharmacy Care Coalition. So, there's only a handful of us here, so I won't belabor you with the formalities, but, you know, across the last 5 years, we've had a very interesting time in pharmacy. And as you know, independent pharmacies are often the first and only point of care in their communities, and that role has really been blown up and really highlighted across the last 5 years. Given that 90% of Americans live within 5 miles of a pharmacy, you guys know better than anybody that community pharmacy care and accessibility is unmatched. But that level of care and that level of accessibility has really been put on public display across the last 5 years. And as pharmacists, while you may be highly trained and trusted, I think I'm not the only one to tell you that you are still underutilized in the broader healthcare system. However, during the COVID-19 pandemic, early stages as well as the vaccination and kind of wrap-up stages of it, pharmacists stepped up in a really big way. You guys delivered care, vaccines, and reassurance when it was needed most. And as a part of McKesson's advocacy strategy on behalf of McKesson, our HealthMark customers, we recognize that valuable role and are working to ensure policymakers at the federal and state level do too. Because oftentimes this is the disconnect. You guys are doing the work, you're touching your communities, you're providing this invaluable access, and somewhere in between the work on the ground and what's happening in the halls of Congress or what's happening in these state halls, there's just a disconnect of like, we get it, they're always there, they're always gonna be there. We thank them so much for their service, but then we kind of forget and we move on. And so part of our advocacy strategy is to really build that up. And as a HealthMark pharmacy, you guys are a part of a network that's actively working to change the narrative at the federal level. And we've been doing it for several years. And I will tell you that our advocacy is focused on making sure your role is not just appreciated, it is not just like seen in the moment, but rather it's fully integrated and it's reimbursed properly in the healthcare system. And so what we're gonna talk about today is kind of this narrative around that reimbursement. So if you'll allow me to set the stage of how we got to where we are today. So as a collaborative effort during the early stages of the pandemic, there was a program stood up called the Federal Retail Pharmacy Program. And it was that program that actually showed what's possible when pharmacists are empowered and they're given kind of an unleashed authority to practice up to the full scope of their state license. And HealthMart was one of 21 national pharmacy partners who participated in this program. We helped ensure equitable access for vaccines by leveraging the accessibility of community pharmacy, particularly true in some of these harder to reach, underserved rural communities where, quite frankly, it was very challenging to serve the needs of patients there. And in fact, pharmacists who participated in that retail partnership program between the years 2021 and 2023 delivered over 300 million COVID vaccinations and more than 50 million flu and other immunizations. It was a testament to those that jumped in the system just how important your role as frontline healthcare providers can be. And it was these efforts, we feel like, that proved the value of pharmacists in a new and unique and tangible way. Because we've been on the Hill for a long time advocating about the important role that pharmacists play, but oftentimes, again, like if it's not tangible and if you're not seeing it happen in front of you, it's hard to really understand that. And so we stepped in front of lawmakers and we were asking them tough questions like, where did you get your vaccine? Where did you get your testing done? Where did you go whenever you weren't sure why you were sick? All of them were like, oh, well, I went to a pharmacy. Of course, it's around the corner. I said, that's exactly what we're talking about. We need to codify some of that knowledge into meaningful federal policy. And these efforts, it proved the value of pharmacists' role in public health. The challenging part that we're about to talk about right now is that the authorities that extended these opportunities and the payment systems that extended, they were temporary. And they've since expired. And so McKesson's role right now is that we are working to make sure that these capabilities are made permanent so that your ability to serve patients doesn't depend on the next public health emergency. Because we understand that like every one of these little payment mechanisms or these reimbursement pieces, they're one brick in the wall of business sustainment. Is this bill that we're going to talk about like the end-all be-all for pharmacist reimbursement? No, but it's an important step such that your testing, treatment, vaccination services that you perform, likely at a cost for some of your patients right now because they learned to appreciate it and receive them when it was reimbursed and is now not, those are services that you should be able to perform that are not necessarily built on the next public health crisis. And as a Health Mart pharmacy, proud to say that you guys were part of that national success strategy and that national story. And now, as a part of Health Mart, you're a part of the solution that we're advocating for in Washington. And so what McKesson has done as a result of all the lessons we learned early on in the pandemic, we helped launch and continue to lead something called the Future of Pharmacy Care Coalition. It's a unified voice for pharmacists, pharmacies, and community pharmacies of all shapes and sizes. It's a coalition that includes organizations that represent millions of patients and thousands of pharmacies, many of which are yours or your customers. And our goal is simple: to ensure that the value you provide as a pharmacist is recognized, it's reimbursed, and it's protected in federal policy. McKesson's leadership in this coalition means that your interests are not just represented, but they're prioritized. Because it's one thing to go up to the Hill and have conversations about the value or the impact of pharmacy and talk about the number of lives that are touched and to talk about the patients that we serve. But we've got an actual tangible issue here in which there's great knowledge and considerable familiarity with for lawmakers. And we're able to go up and say, look, this isn't just a talking point, it's a prioritization of this issue. And being a part of Health Mart means that you're not just represented, rather you're a part of a national advocacy effort that's helping shape the future of pharmacy care right in front of you. And that's what this coalition is about. And in fact, this coalition doesn't just advocate, it operates. We coordinate things like press briefings, we develop unified messaging across a whole host of retail partners, we align on Capitol Hill strategy, and ensure your voice has meaningful representation in front of the lawmakers who are actually tasked with signing these bills and pushing them through the committee processes and making them law. Coalition is really good about bringing together folks who are really smart, sharing talking points, co-authoring op-eds, leveraging full communication and policy resources of a whole host of member organizations, including McKesson, to share these stories. And you can see McKesson is joined by a lot of different powerful organizations that are helping push this narrative along. So the effort we're working on, if you'll allow me to introduce you to a piece of legislation we affectionately call ECAPS, the Ensuring Community Access to Pharmacy Services Act. It's a bipartisan piece of legislation. In my town, my world, that means it's got Republican support, it's got Democratic support, it's got a House piece of legislation, soon to have a Senate piece of legislation, and it's a direct response to what we learned during the pandemic. Pharmacists are essential providers of care, and they deserve to be reimbursed for the services they provide. It allows Medicare to reimburse pharmacists for services like flu, RSV, strep, and COVID-19 testing, as well as the treatment and the vaccination services many of you provided in the pandemic and were reimbursed for, and many services you probably provide today and aren't reimbursed for. Importantly, this bill respects state scope of practice laws and applies in states where pharmacists are authorized to deliver these services. McKesson is actively advocating for this legislation because we know how critical these services are to you, but more importantly, how critical they are to your patients. We don't kid ourselves. We know it's not the end-all, be-all piece of reimbursement legislation. But again, we recognize this, along with a lot of the other tough conversations that are being had in Congress right now, is one of those building blocks to securing a strong and healthy financial future for you and your pharmacy. And this legislation is about, honestly, at the end of the day, is about leveling the playing field so you can compete and care without financial barriers, because you shouldn't have to choose between paying the bills and caring for your patients. So, as far as the legislation itself goes, details, it's a bill called H.R. 3164. We've worked on this piece of legislation across the last several years. We're proud to say this year this legislation is gaining significant momentum in Congress. In fact, thanks to strong bipartisan support, two strong members here, Rep. Adrian Smith as well as Brad Schneider, as well as the two pharmacists you heard from earlier today, Buddy Carter and Dinah Harshberger. They got real-world experience that understand what this bill does and how they need to communicate it with their peers as well as how they need to communicate it with some folks who just need a little help understanding kind of the mechanisms this goes through. It's also championed by a whole host of pharmacy community members. And you saw the screen before, but we'll touch on a few others in a minute. But this has got the right mix of support at the right time, we believe. And we believe that it's not just a policy idea. It's a legislative reality that's moving forward because of the groundwork we've laid across the last few years. McKesson's government affairs team is meeting with lawmakers, educating staff, and building coalitions to ensure this bill gets across the finish line. We're chasing every legislative avenue, whether it be temporary funding packages, government reconciliation packages, larger healthcare packages, whatever it takes. This bill has the mechanisms and means and support, we feel like, to get across the finish line. And as a Health Mart pharmacy, you can rest easy knowing you're a part of a network that's not just reacting to policy, rather you're helping shape it. While McKesson is helping lead the charge, it isn't just a McKesson initiative. You'll see on the screen right here, it's a movement that's supported by more than 170 organizations across healthcare. We're talking about patient advocacy groups, rural health organizations, senior care advocates, and pharmacy associations, many of which you've heard from already today or across the last couple of days, all aligned behind a single effort. It's hard to put all of pharmacy in one tent. We don't always agree on things. There's always some sort of discord between the means and mechanisms and how we align behind things. The Future of Pharmacy Care Coalition has managed to put everybody in the same tent, speaking from the same voice, trying to move one effort along. And as a Health Mart pharmacy, McKesson is leading the charge on this to show that we can bring these voices together, to show Congress it's not a niche issue. It's a national priority that they have got to pay attention to. As a Health Mart pharmacy, your needs are being championed by a coalition that's broad, diverse, and growing. And this is the kind of unified support, ultimately, at the end of the day, that moves legislation, and you'll be happy to know that McKesson is helping lead that charge. Look, I know this is a lot to take in, especially if this is your first time hearing about this legislation or the Future Pharmacy Care Coalition. However, it's why I'm here. It's exactly why McKesson is doing this important work. You don't have to navigate the federal policy landscape alone, and quite frankly, you don't have to do it at all because McKesson and the McKesson Health Mart Network is helping you lean on that to get it done for you. If you have questions about how this impacts your pharmacy or how you can get involved, I'm here to help. And if you're a part of Health Mart, you're already part of the solution. We're advocating for you every day. So, thank you for being here today. My contact information is up here, but I'm also happy to answer some questions if any of you have them. Who has questions about ECAPS?
What are some ways that people can get involved if they're interested in talking to their member of Congress or they want to advocate more?
It's a great question, Christine. So we have a public policy page where you can see what McKesson is doing to support independent pharmacy. And if you're not already plugged into our advocacy updates through Health Mart, I would encourage you to do that. You can go to the advocacy portal at myhealthmart.com and sign up. We've got great McKesson staff who are walking around here who are happy to help you figure out how you can best both get the updates, but also take an active role in advocating. You heard the members of Congress sitting on stage today, and they were saying essentially, if you're not willing to step out and take a chance, lend your voice, be a part of the solution, there are folks willing to come in and advocate against it and advocate against us. And so I'd encourage you, whether through the Health Mart Advocacy Network, whether through your own integrated networks, whether through the state pharmacy associations that you participate in, this is the time. This piece of legislation is not an idea. It's not just a concept that has been pulled together. It's a piece of legislation that has been well vetted, it's been pulled together, and it opens the door through permanent Medicare Part B reimbursement for pharmacists, a unique venue which we've not had before. This Medicare Part B may be for a limited set, RSV, strep, flu, COVID-19, testing, treatment, vaccination services, but it's the first of its kind. It's the opportunity to step through the door of Medicare reimbursement for pharmacists and create an avenue for future reimbursement opportunities and a future ability to practice up to the full scope of license in your states. Yes, ma'am.
So, what would be the counter argument we should be prepared for when advocating?
Counter argument mean from outside groups that are wary of scope of practice, or
so-and-so came in last week and they said this would be bad because of this.
No. It's a good question. So I will tell you, we've done a lot of work laying the groundwork to bring most of these camps together. I don't think there's necessarily a natural enemy in healthcare to providing these sets of services that are already being done in the pharmacy. I would tell you from a cost perspective, this bill actually ends up, saving the government money, and depending on how you structure this, if you will. But pharmacists are reimbursed at a lower rate than physicians are for these services. And so, that traditional argument of like, are we creating an avenue by which we're going to cost more money, or we're going to open a door for additional services and costs, that doesn't necessarily exist here. You've got traditional, battle lines, if you will, that have been drawn around physician community and pharmacy community. But I will tell you, this bill actually has the co-sponsorship or the support of a number of physicians in Congress who've kind of carried that mantle and said, look, pharmacists are simply trying to practice up to the full scope of their license here, and these are services that they've been performing already. And as we kind of try to frame it a lot of the times, like most of the folks walking into your door looking for a testing, a treatment, or a vaccination service, it's because their whole concept of healthcare and where they received it was rejiggered during the pandemic. They aren't just like waking up and saying, oh, there's a new way to take a reimbursement dollar out of somebody's pocket. They've been seeing a pharmacist for these services for the last 4 or 5 years, and the pharmacists that are still performing these services are doing it oftentimes at a cost out of their own pocket. And I've had conversations. We actually took the Speaker of the House and his staff into a pharmacy in Louisiana last August and introduced them to the pharmacist who was practicing in his parish, his hometown. And she kind of opened the door for kind of an eye-opening moment. She's a community that's only about 4,500 people. About 3,500 people. And she opened their pharmacy rolls and she said, but here are the number of patients I have on my pharmacy roll, 17,800. And he was like, well, why are there so many people coming to the pharmacy? She said, because we're the only one. Like there's nobody else performing healthcare of a substantive nature in this parish. And she said, there used to be this pharmacy, this retail pharmacy, they've all closed. We're it. We're only 2.5, 3 years old. And she said, I opened this practice and was told it was going to take 2 or 3 years to survive, and I was going to really understand it. And she said, I have to be honest with you. When I opened my door, my profit margin was, 3 or 4%. And she said, my profit margin didn't go up. My patients have gone up, but my profit margin has gone down to 1.8. And she said, 1.8 is almost zero. It's close enough. And she said, when your pharmacy roll goes from 4,500 to 17,000 and your numbers don't go up, they go down, she said, there's something wrong with the system. And he said, well, why is that? And she said, look, we got folks coming in because they understood that we were the primary source of these basic questions and healthcare concerns and chronic care and all the other things early in the pandemic. And she said, all those authorities have expired and gone away. And she said, but they're not, somebody forgot to tell the patients, because the patients are still coming to us to be tested, treated, and vaccinated. And she said, I don't have the heart to tell them no. So she said, I keep ordering the vaccinations, I keep ordering the testing kits, and I keep performing the services. And she said, every time, I know, she said, I can make eye contact with the patient as they're walking through the parking lot and they're coming in. She said, I know how much that patient's going to cost me. Not how much I'm going to make or not if I'm going to bring it. She said, I know what that service is going to cost because I'm not being reimbursed for it. And so it was like this eye-opening moment. And so it's kind of that message that, to your point, when somebody says, like, what's the flip side of this? We've done a lot of work making this flip side largely non-existent. This is a mechanism issue right now. Like this is Congress trying to figure out, like, how does it put the pieces together and how does it drive the bus at the same time? We had a great opportunity for this piece of legislation at the end of last year. You heard Congressman Carter this morning talk about how there was healthcare legislation that simply fell apart at the end of the year. This was in that. This was in that mix. And so this is less about like natural enemies or opposition to the issue and more about finding the right spot for it. And so that's why McKesson has spent so much time, effort, energy on it, because we feel like we've done all the education, we've gotten a lot of these offices in the right ground, we've got the legislation structure to the right point that, again, this is not an end-all, be-all for your pharmacies. You're not going to walk away and say, man, like this is the perfect form of pharmacist reimbursement, but it is starting that meaningful conversation, opening the door to Part B reimbursement for these sets of services so that you guys are reimbursed for the things you're already doing, but also can prove your mettle, if you will, for other services as we go. Anybody else? Who wants to go to Capitol Hill? Who's ready to advocate? Oh man, this guy right here, he advocates occasionally. Guys, I'll just tell you that, I think they were being very serious on stage this morning, and I hope, a little bit of education I've given you here today is serious as well. Like, this is the time. Like, again, like making that connection between, the members of Congress who actually have the power to move legislation and kind of a niche legislative idea like this is only relevant when they understand it and it's tangible. And this is as tangible an opportunity as we've ever had. Again, like having members of Congress who can still remember back to when the world was sideways and when they didn't know where to go, they walked into a pharmacy to get tested, treated, and vaccinated for important services and things they didn't know wrong with them. This was, they realized that, they remember it, so this is our chance. And so even if you've never taken like an active role in advocacy, if you've never stepped out and said, oh, I want to participate in my state pharmacy association, you've never reached out to the Health Mart network and said, I'd like to be a part of the advocacy network, like this is it, man. Like this is our best chance to move this piece of legislation and secure this, the future of this bill, because it really is the linchpin for future pharmacy reimbursement going forward. If we can thread the needle on this piece of legislation, it creates an opportunity for pharmacists to further prove themselves in doing so through Part B reimbursement in a paid mechanism. Because I will tell you, as you heard Congressman Carter and Harshberger talk earlier today, there are meaningful conversations happening within the administration right now over at CMS about like, how do we further utilize pharmacists? How do we lean on pharmacists and the unique role that they play because of the communities they sit in where there simply is no other form of care? So this bill is like real and live, and if you've never advocated for something before, I'm asking you to step outside your comfort zone and advocate for this, because I do think that we've got a real chance to do something cool. So, any other questions about ECAPS or anything else? The Health Mart Network, advocacy. We got a McKesson advocacy ambassador sitting over here to tell you all about what it's like to work a day job and then also go to the Capitol Hill and advocate. It's not as scary as it seems. And you know what? Advocacy, as they were talking about earlier today as well, it doesn't just have to be about getting on a plane and going to Washington, D.C. It's about having meaningful conversations with local community members about other pharmacists, encouraging them to get involved. It's about educating on like how you band together. This is an industry that plays a vital role in healthcare, and if you don't band together now, when are we going to band together? Like this is an opportunity for us to do that, but you don't just have to advocate, get on a plane to come to Washington. You can talk to local council members. You can talk to your state reps. You can come to the advocacy folks at McKesson, and we'll help figure out ways to move that along, but this is the opportunity. So my contact information is up here. I'm happy to answer questions after this is over. I'm happy to answer questions in arrears. Send me an email. This is something that I've worked on for a number of years. I'm invested in it just as you are invested in it. We believe this is the right thing to do. And I'm proud as Health Mart customers that you are invested in this as well, because this is your interest and we're advocating for it in the best way we can. So thank you guys very much. I appreciate it.